Kila mtu na familia yake ana haki ya kuishi kwa afya nzuri pamoja na haki ya chakula, nyumba, matibabu na huduma za kuishi.
If I could change one thing about Africa, I would change the way people are currently supporting African countries. I think the most important thing that Western communities can do is to work from the ground up. My name is Rebecca Conti. I am a registered nurse and the executive director of MED25 International. MED25 International is a nonprofit organization that started in Seattle, Washington in 2006. Our name comes from the 25th article of the Universal Declaration of Human Rights, stating that all humans have the right to access health care. So since 2006, we started constructing clinics and other care centers for those in need in rural communities in Africa. When I was a nursing student at Seattle University, I always knew that I wanted to be a nurse, and I always knew that I wanted to work in Africa. It was a calling that I had in my heart. My first trip to Africa was in 2006 when I traveled to the West African country of Ghana. And working there, I saw the world's disparities firsthand. I saw patients refused health care every day, and patients that had treatable diseases but weren't receiving their human right of access to health care, either because the facilities didn't exist or because the facilities that were there did not meet the needs of those patients. Working with HIV patients in Ghana gave me a very good picture, I think a very accurate picture of the status of people with HIV. They were discriminated against. People that were known to have HIV in the community were shunned by their community. Oftentimes they lost their job. If they were children, they were kicked out of schools a lot of the time. And so you just saw firsthand how people can be rude and can judge other people based on something that might not be their fault. We have patients that were raped and that's how they contracted HIV, or children that were born with HIV because their parents had HIV. So many illnesses that were out of the person's control that then they were judged against. The biggest challenge we face when working in the field is community members that do not want to take Western medicine. We have a lot of herbal and traditional beliefs and treatments that individuals take. So a lot of times if they come to seek healthcare, they will still take their own herbs and traditional medicines, which can conflict with Western medicine. So what we do as a nonprofit is we try and provide as holistic care as possible and make sure we are learning about the herbs and medicines that they use on their own and how those can interact with the medications that we might prescribe, so that we could respect their beliefs and their traditions as well as provide them the medicine they need that can help them improve and get healthy. It is very difficult to be a nonprofit in the current economy that we are in today, but you hold on to all those stories of the patients' lives that you change. My first patient I ever lost was a 21-month-old baby. His name was Kelvin, and he died of HIV. And that story stuck with me, and that made me determined to not lose other children, to do whatever I could. The stories are what you hold on to that gets you through the frustrating times and the patients you lose. You still hold on to your success stories.